As we get into chapter 6, we're going to look at the strong influence one's situational and environmental issues has on long-time healthy behaviors, and specifically in the area of exercise. We're also going to be able to find the factors necessary to encourage a person to engage in lifelong healthy habits. While we've discussed already the personal characteristics of a person's desire to engage in healthy lifelong habits, in this chapter we're going to look specifically at the strong influence of our social environment that has a huge impact on a person's desire to begin and maintain healthy habits. As we consider social support, specifically for exercise habits, we're referring to the degree a person receives support physically, mentally, emotionally that they get from others. And when we look at social support, it can be divided into two categories. One is primary support, and this would be somebody directly providing some sort of support, maybe an exercise buddy. That would be a primary social support. But also it can be a secondary, an indirect. Perhaps your doctor encourages you when they discover through exercise you've lost 10 pounds. So social support can come directly, primarily, or it can come in a secondary way. Both have substantial effect on a person's exercise behaviors. This is an excellent chart that provides examples of different types of social supports that we can receive in an exercise and health setting. So let's go through them quickly. First of all, instrumental support. And basically that just is talking about a hands-on, somebody is exercising with you, somebody's right there. A fitness coach could help spot you. They could talk about your fitness results. Perhaps your employer gives you time off to exercise. So instrumental support is a direct, hands-on type of support to encourage you in your exercise behaviors. The next category is called emotional support. And this is the idea where you get praise, you get support. It might be a family member giving you encouragement and telling you how great you look. It might be a health coach telling you about your recent test results and how much you've improved from your previous results. So that's emotional. Informational support can be either educational or it can be through feedback. Your medical professional sometimes give you informational report, maybe instructions on a certain way to use a piece of equipment. Another example might be a person buys material that will help them learn how to implement healthy habits. Another type of support is companionship support, just what it says. A person exercises with others, maybe an exercise buddy with friends. And another example, maybe your fitness coach spots you on the machine. And then the final type of support is validation. And this is where you compare yourself with others on a particular characteristic. We all tend to do this. You know, if we're in an exercise class, we're kind of comparing ourselves with the other people in the class. If we're maybe an older person in an exercise class and we're seeing that we're keeping up with a younger person, that validates us a little more. So those are the different forms of social support, different examples. one of the strongest situational supports that we can have is the use of fitness coaches. So the next couple of slides will talk about what we should look for in fitness coaches if we are a fitness coach, the qualities we should have. And I'll spend just a few moments going through these. But obviously, you want to have a good knowledge base based on the science of fitness and physiology. You should be able to conduct testing. You should be able to demonstrate proper technique. You should be able to give instruction and guidance and help your client, your patient, reach fitness goals. Obviously, desirable characteristics in a fitness coach would include looking the part, having a healthy appearance, eating properly, getting good sleep, again, having a good knowledge base in the area of testing and leadership, and just being able to help in ways of improvement of health and fitness. Additional qualities you're looking for in a fitness coach would be understanding special groups. If you're working with cardiac rehab patients, or you're working with someone who's just coming off an injury, knowing how to work with different populations, being a good communicator. We say good fitness coaches are good teachers, just good interpersonal skills, good administration skills, organization skills, and again, able to lead exercise sessions and classes. Now, fitness coaches should be able to use mental skills, cognitive strategies. That's much of what we talk about in this class, as well as behavioral strategies. And then again, being familiar with the research and being up to date on the practice and policies of fitness training. So if you are a fitness coach, these will be the qualities, characteristics you want to possess. And if you're looking for a fitness coach, again, these would be the qualities, characteristics you would want. Some other situational factors that we need to consider and what promotes physical activity, the availability of an exercise facility and proper equipment, the availability and participation of being able to be involved in fitness classes, the location of the facility. They say it needs to be within 3 miles of your home or work, or on the way to home or work. So you don't want to be involved in a facility that's too far from where you are. And then obviously you need to have transportation to get to the facility. Situational factors that would help promote physical activity would include your finances. Do you have money to purchase clothing and shoes, and can you buy a gym membership? How about purchasing home fitness equipment? What you have available to you as far as education, and if you have the opportunity to have a fitness or nutritional coach. Those all would be considered other situational factors. As well, now looking at the environmental factors that would support physical activity. We ask the question, how does my environment promote physical activity? And questions that you might ask, would be, is the neighborhood safe for exercise during the day and in the evenings? How about road availability? Are there jogging paths? Are there biking paths? Are there green spaces? Are there local parks that can be planned and constructed to help enhance an active lifestyle? Many are in places of the country where the environmental factors actually encourage people to get out and get moving. Whereas other parts of the country, there are limitations, be it not an available green space to exercise in, or maybe not safe. I was in Florida for many years, and people were always out exercising. There were all kinds of jogging and biking paths. Then I moved to a little more of a rural area where the roads are very narrow. There's no way you could bike on the road safely, and you just don't see as many people out exercising. So environmental factors definitely impact whether or not you're able to be physically active. This diagram is an excellent example of how to encourage an environment where you can enhance health and physical activity. It's called the social ecological model for health and physical activity. Quickly, just let's go through it. You have different agencies working together and putting policies in place that will help enhance an environment that encourages physical activity and health. So, for instance, the local government, transportation community groups can think about how to reduce crime in an area, how to develop bike lanes. Your park and rec department obviously can provide community facilities and programs. The roads department can provide biking paths in areas that people can safely walk. Government buildings, as far as architecture and how to build them, supporting more indoor activities. We can talk about health insurance and government and having incentives for people to actually get outside and exercise. And then education groups can help educate people. So many groups coming together, working together to provide an environment that encourages and enhances health and physical activity for all. Up this chapter, there's discussion about how to create job incentives so that we can promote healthy lifestyle choices. And so for health and fitness being encouraged within the workplace, again, it's a win-win situation. There'll be reduced health costs that will then help the employer. It will provide fitness programs or having opportunities to have an exercise facility. It will increase the productivity of the worker, and they're less likely to miss due to illness. Of encouraging physical activity and healthy lifestyle choices within the work environment, the employer gives incentives. It could be financial incentives or other incentives that helps encourage the worker to be involved in an exercise and nutrition program to help with weight control and just to improve overall health and fitness, even to the point where you give the employer and gives the employee time off during the workday. I have a friend who actually gets an hour exercise break 3 days a week, which is great. And again, just encouraging workers to exercise. And in the long run, this is really a smart move by the employer because they are going to see great payoffs if they get their employees in a better state of health. A review for this chapter, we looked at the factors that influence health behaviors, increasing physical activity and exercise. And we talked about various social supports. We talked about the fitness coach. We talked about other situational factors, and we finished up talking about environmental factors. So as much as possible, we want to encourage healthy behaviors. And so these are ways that this can be accomplished.